Okay. Good morning, everyone. We are so excited to have you with us this morning for our Children's Advocacy Network 2022 Policy Wrap-Up event. I am Elise Norcross, and I'm one of the Government Relations Specialists here at Boston Children's Hospital, and I will be your moderator for this morning's event. If we could just advance to the next slide to the agenda. Great, thank you. This morning we'll be hearing from three of the directors in our Office of Government Relations. We'll be hearing from Amy DeLong, who's the Director of Federal and External Relations, Shannon Moore, who is our Director of State Government Relations, and Amara Anasike, who is our Director of Behavioral Health Policy and Advocacy. They will be sharing the status of our legislative and advocacy efforts at both the state and federal levels. We are excited to share with you both the progress we've made and victories we've seen over the past 2 years, as the state has now wrapped up its formal legislative session and the federal Congress is nearing the end of its session. At the end of the presentations, we'll have some time for Q&A with our panelists. A few housekeeping matters before we get started. During the presentation, please feel free to submit any questions through the Q&A feature. We will address them at the end of the presentation. If we are unable to get to your question during the live event, we will try to follow up with an answer to you directly. If you would like closed captioning during the presentation, please look to the bottom of your screen. There is a little box with the letter CC inside, and it is captioned live transcript. If you click this button and select show subtitles, you should begin to see closed captioning at the bottom of your screen. If you have any technical issues during the presentation, Sarah and Alexia from our team are available to help via the chat and will also be monitoring the Q&A. Please note that the chat feature will only let you chat to the hosts and panelists. Chat to the entire group has been disabled for this event. We would also like you to please note that this session is being recorded. After the session is over, you will receive a recording with the panelists' email addresses, a link to the session, and you also get the slides and an evaluation form so that we can improve our future events. So without any further ado, let's get started. And I am pleased to introduce Amy DeLong, our Director of Federal and External Relations, to discuss our progress with federal policy. Thank you.
Hi there. Sorry, playing with my camera, trying to get it on. Welcome. I am not sure if folks can see me, but I will start talking. I wanted to make a quick note on the federal legislative process that we're going to walk through there. The federal legislative process in Washington, D.C. Is a bit more fluid in terms of when it ends than a state legislative process is. Just to note for this group that technically the federal legislative process, the Congress should adjourn on October 1st, but they never really do. Many sessions, including this one, will likely lag through the elections and maybe also continue on to a lame duck session. So things can still happen at the federal level in terms of legislation being passed and things getting done. So while this is supposed to be a wrap up, we aren't really fully wrapped up at the federal level yet, which is a good thing because some important things do remain undone. So Congress is back from August recess. They took a bit of a break and returned after Labor Day with a lot to do. And most notably, they need to pass a short-term funding fix, at least a short-term funding fix, to avoid a government shutdown by September 30th, which is when the fiscal year ends. And it seems likely they will pass that fix. We are not looking at a likelihood of a government shutdown, which we've seen happen sometimes in recent years. Seems likely they will pass something. And once that's passed, the heat is really on them to come up with a deal for all of fiscal year 2023, which technically starts on October 1st. It's not clear how they're going to get there. They're likely to pass also some Medicare and maybe hopefully some health related bills, but we're not sure how comprehensive they will be. So there's definitely some priorities at the hospital caught up in this process, which I'll mention. And I just wanted to make that note. So my policy wrap-up piece isn't totally wrapped up. And that is why. So we can go to the first slide though, and sort of talk about what our priorities for this congressional session have been. And these are shared priorities with our peer institutions, other children's hospitals across the country. And they're really laid out here in themes that we established before this 2-year congressional session began. And we've worked toward over the past 2 years and still have a ways to go. I'll note that when it comes to the development and execution of our federal agenda, we can't go at it alone. We're a major children's hospital, but we're just one children's hospital. And in order to make a difference in policy at the federal level, it's important to collaborate with others across the country. And we do this in a variety of ways, most notably through the Children's Hospital Association and the Coalition for Pediatric Medical Research. And these are the themes that we worked together to set out at the beginning of the year. So the first one you'll see on here, probably not a surprise to anyone that's followed CAN for the last couple of years, it's children's mental health. The mental and behavioral health crisis with our kids that we're experiencing in Boston is not unique. Like most of our federal work, we've discussed this with our peers across the country and all agree that this crisis had to be at the top of our federal agenda. People need to know that it's happening. So for the past 2 years, we've engaged with other children's hospitals in raising the alarm on kids' mental health and letting kids know that letting Congress know that the current situation with our kids is just unsustainable. So top of the agenda there. Also CHGME, and stands for Children's Hospital Graduate Medical Education. And this is on our agenda annually, and for good reasons. The Children's Hospital Graduate Medical Education Program makes it possible for us to fulfill our mission as a teaching hospital, training the next generation of pediatric providers. The program is subject to annual appropriations, so we are constantly working to highlight it to federal lawmakers and before the Congress. Medicaid, also a regular feature on our federal legislative agenda, with it being such a critical program for children, and it's a federal state shared program. It's all over both the federal and state agendas. While states administer their own Medicaid programs, the funding is shared between the federal government and the state governments. And our work at the federal level also often has to do with setting rules around Medicaid and how the states operate within those, and also managing children in the Medicaid who need to cross state lines for care, who are often among the most vulnerable or medically complex. And lastly on this list, increasing support for NIH pediatric research. We are committed to being a voice for children in the research arena. We see pediatrics or childhood diseases often receiving proportionately less funding than other areas of research, and we're uniquely positioned to be a voice here. Additionally, we're working with our peers at pediatric research institutions on strategies to encourage physician scientists to enter the field of pediatric research specifically, which I'll talk a bit about our priorities there and where they stand. So we can go to the next slide, which talks about the progress that we have made and also what we still have to do on mental health. So the first thing highlighted here, the Bipartisan Safer Communities Act, which the bill itself certainly wasn't on our agenda 2 years ago. It's something that came together in the wake of the school shooting in Uvalde, and very noteworthy because Congress did manage to pass into law the most significant response to mass shootings in almost 30 years, and this was it. While it was far from everything that we need in a lot of ways, it was noteworthy, and it did include some positive mental health, school mental health related provisions. So I do want to pause here and just say, from a legislative and messaging standpoint, the conflating of mental health as legislation as the response to mass shootings is kind of troubling, even if only from a stigma standpoint, but this is how it played out. The bill that passed into law contained grants for states to implement red flag laws. It also required the existing system for background checks to better coordinate with state juvenile justice systems. But most interesting to child health advocates, the bill included a lot of new funds, like billions of dollars for school mental health treatment, so states can invest in community behavioral health clinics as well as school mental health programs. So that's a start. It's a really good start. There's also listed below that 3 other bills that are our priorities and that we as a children's hospital community developed with congressional champions. And these 3 bills really lay a solid groundwork for what we need. So these are our priority bills. Right now, through the end of the year, would be great if these bills or pieces of them could pass in any healthcare legislation that moves. And if they don't, you will see them appear again on our agenda next year. The first one listed is a bill in the House called the Strengthen Kids Mental Health Bill. And this is really comprehensive. It includes workforce, infrastructure, community-based access, really takes a comprehensive look at the landscape for kids' behavioral health now and what do we need to improve it. It was introduced for the first time this session within the past year, and just introducing it alone is a big step to get everyone together, to put it down on paper, to have if congressional champions introduce it in the Congress and have it ready to go like that is real progress. And then there are 2 Senate bills listed here, and just the distinction between them, they're both important. One is a grant program or several grant programs, and the other has to do more with direct Medicaid funding. They're both important pieces. So sometimes just getting it all introduced is actually real progress. And I think that's true here because these are new bills. Realistically, the language from these bills should be on the table now for any and every opportunity to move something forward. And I feel much more ready to support members of Congress who are looking to engage on mental health at the federal level than I would have at this time 2 years ago. So we're still trying to grow co-sponsorship to include, to build support in the Congress so that these bills or pieces of them could be included in any healthcare package or mental health care package that might happen before the year ends. And if you are a member of the CAN, you may still be hearing from us about proposed actions on these bills. We can move to the next slide. Federal advocacy progress. So CHGME, I mentioned before that this program is important to us here at Boston Children's and allows us really to fulfill our teaching mission. It's also a really good example of why we need advocacy at children's hospitals. Children are often an afterthought in healthcare policy. Other teaching hospitals that train adult providers receive GME, graduate medical education funding, support through the Medicare program at the federal level. This is an entitlement program. Medicare is not something that Congress gets to decide every year if they're going to fund it. They have to fund it. It's built into the budget. It's built into the federal budget. It's built into the law. So hospitals that train adult providers receive GME funds through Medicare almost automatically every year. We as a children's hospital aren't eligible for Medicare GME because we don't see the necessary threshold of Medicare patients being a children's hospital, Medicare being a program for older adults. So for hospitals like ours, for many years, we didn't get federal GME dollars, which not surprisingly, 20 years ago or so led to a crisis and that there weren't enough pediatric providers, and Congress, it came to their attention. They took a look at it and considered that maybe the reason why we didn't have enough pediatricians, pediatric specialists in our country was because we weren't supporting their training at the same level as we were for adults. So they created a new program, a standalone program called the Children's Hospital Graduate Medical Education Program, CHGME, and it's just for hospitals like ours that are freestanding, not part of a bigger system that also cares for adults. So it's great to have. It's critical to our work. It's still not at parity. We get like 50% per resident when you compare to what adult hospitals get from the Medicare GME, but we need it. So it's tied up in the annual appropriations process that I mentioned earlier. We went in with a big ask. We've been asking them to get us to parity with the adult programs. We didn't get it. It's not in the draft bill the House and Senate have put forward. House bill only recommended a modest increase from last year's funding of CHGME, which was last year it was $375 million. The House proposed putting in $385 million. So not all of this comes to Boston Children's Hospital. This is for 56 hospitals across the country to share. Although we are the largest recipient of funds because we train the most people. So we expect it will be funded at a similar level or modest increase from last year. It's out there, and once we tie up this budget cycle, I'm talking about the CHGME so much because the program is due for reauthorization next year. So you can expect a lot more discussion about CHGME in the coming session. They have to fund it every year, and every 5 years or so, they have to open up the whole program and look at it and talk about the allocations and how what the formula is like for which hospitals are eligible, which hospitals receive how much funds, what the formula looks like. So we'll be talking a lot more about CHGME in the next year as it's due to both be reauthorized and the annual appropriations process. So CHGME. The next bill on this slide, the Accelerating Kids Access to Care, I really like this one. Sometimes we call it Medicaid Screening and Enrollment Bill, and we've had events through the CAN on this bill specifically. It's kind of a homegrown bill, a response to a problem that we heard about here at Boston Children's and then found out our peer institutions share this problem. It's a barrier to treating out-of-state Medicaid patients, really important for access. The issue the bill aims to address is one specific to hospitals that see a lot of Medicaid patients, like us, as a hospital that cares for kids from out-of-state Medicaid programs pretty frequently. Our facility and our providers need to enroll in the Medicaid program of a patient's home state. Each state administers their own Medicaid program. We see more than 40 state Medicaid program patients each year, are from 40 different states, which means 40 different processes. And some of the states have very complicated processes, expirations after just a few months if you don't see the patient for that period of time. Some have very detailed requirements that are all designed to weed out fraud, but don't make sense for us and cause a lot of administrative work to keep our enrollment in good standing in 50 different programs. So we proposed a streamlined process for providers that are all in good, providers like us that are in good standing with their home state programs like Mass Health. And it's now a bill and it's enjoyed some good support. It's been introduced a few times and we have focused our efforts for co-sponsors and education around what this bill does because it's not a super controversial bill, but it is a bit technical. We focused on committee members in the House and Senate that would hear this bill. And this year it received a score from the Congressional Budget Office, which is a good sign that the sponsors and committee members are looking at it seriously. There's been a great deal of discussion with committee staff. So we're hoping that we're well poised for this bill to continue to move forward, again, if not this year, to be reintroduced and worked on again in the next session. But we'll see where things go. We can move on to the next slide, which is about research. I mentioned we work in coalition with other pediatric research hospitals. Historically, we came together around a bill related to networks of research, and we've always worked to increase the share of funds at the NIH, especially that are dedicated to childhood diseases, and we still work on those things. But in the past couple of years, our work has grown to include a focus on developing the next generation of pediatric researchers. So this first bill that you see, the bill that you see listed here, the PACT Act, which stands for Pediatricians Accelerate Childhood Therapies Act of 2021, was a reintroduction from last session and has received good attention from the committees. Our focus right now is to build targeted co-sponsors, committee members who can continue to work through the process. The bill would address the challenge in the pediatric research workforce by establishing a new trans NIH or cross NIH career development award focused on early career pediatric researchers. It would authorize a statute. It would make a law for this process that already exists, that is sort of in process at the NIH to better coordinate and manage their research portfolio across all institutes and centers at the NIH. The NIH is comprised of many different institutes, and a lot of them work on a little bit of child research here and there, but sort of pull it all together. This early career research focus that we keep talking about really aims to include physician scientists who can work from basic science to translational research, direct awards to researchers focused on pediatrics who maybe haven't yet achieved research independence. It also includes language that would allow the NIH to prioritize qualified applicants from populations that are historically underrepresented in the field and to support programs focused on developing that kind of research talent. So it's a big bill. It was designed together with physician scientists talking about like how can we attract more people into this field because we can't make progress if we don't have people working on it. So it's a good bill. The bill hasn't passed into law itself yet. So as part of the ongoing effort, we also worked with the coalition and members of Congress to include language in the appropriations bill that's working its way through the Congress, the FY23 appropriations bill, to recognize these challenges. So we couldn't get the bill into law. We did get some language in the appropriations bill that acknowledged those challenges. And when you do that, the NIH, which is the agency that oversees medical research, they'll hear the message from appropriators in Congress who fund them that exploring solutions to these challenges is important to the appropriators. So that language is a success in itself and should hopefully stay in the appropriations bill as it moves forward. We can move to the next slide, which is regulatory victories. Very exciting. Eighth Kids, this was actually a legislative victory some years ago, a bill that we worked on for 10 years that was eventually signed into law by Donald Trump. It goes into effect in a matter of weeks and will allow better coordination of care for kids crossing state lines. So that is an exciting thing and something that is coming up, and we're working with different states and hoping to see them take advantage of this sort of eased ability to coordinate healthcare for kids who have to cross state lines for care. And then we also noted CMS has put out the Center for Medicaid and Medicare Services, which oversees the Medicaid programs in the United States, has put out actually a series of requests for information over the past couple of years that we've been able to respond to, and our responses really highlight the challenges for children. So we put this one up here. We responded to, they put out a request for information related to advancing health equity and reducing health disparities, and asked for information from children's hospitals, other providers, and people that care about kids on a lot of topics, ranging from access to provider payment rates to, it goes on. So we were able to respond to that. So we consider that the fact that they asked and the fact that we were able to comprehensively respond to a number of these things. So this is probably the biggest one that we worked on this year as a victory in itself. So with that, I think that's the end of my slides or my portion. And I will we'll move on to Shannon. Thanks.
Awesome. Thanks, Amy. Yes, so now we will hear from Shannon Moore, our Director of State Government Relations, to hear about some of our successes and victories at the state level.
Thanks, Amy, and thanks, Elise. Again, my name is Shannon Moore. I'm the Director of State Government Relations here at Boston Children's Hospital. As Amy mentioned, the state update is a little bit more clear-cut as the state legislature runs on a 2-year session. The session does end at the end of this calendar year. However, July 31st was kind of the end of when debates need to happen. So a lot of actions were taken on major bills that were on our priority list. So we're going to update everyone on those today. Next slide, please. I just wanted to start out by saying where we came up with these priorities. So in the summer of 2020, kind of the height of COVID, we were looking towards what bills should we start to support when the session started in January 2021. Some of you on the call might recall, we emailed out a legislative survey asking what was on everyone's minds for the Office of Government Relations to support at the state level at that time. And the responses that we heard, at the height of COVID in the summer of 2020 was really, folks were worried that patients weren't going to have continued access to their healthcare, health insurance, telemedicine, and telehealth. The social determinants of health was really concerns that folks were going to lose their housing and have difficulty accessing food. And we also heard a lot of requests asking that we focus on racial equity and social justice in our legislative agenda. So this is kind of how we bucketed out those responses to guide us in the 2021-2022 space. Next slide, please. So out of that, we came up with our legislative agenda. Today, we're going to discuss the 10 bills that were on our legislative agenda. When we set an agenda for our top priority bills, we commit to providing written and oral testimony to all of those bills. So 100% of those bills received written and oral testimony. As you can see on this slide, 80% were reported favorably by their initial committee, which is probably one of the most important steps in the process, is getting it out of the initial committee. And then 50% of all of our priorities were signed by the governor or passed through other legislative or regulatory mechanisms. So next slide, please. So what was on our legislative agenda? As I mentioned, kind of the broad strokes in the buckets there. We supported a bill that would establish a common application for public benefits. This is important for families who might be eligible for different safety net programs. The way the state had been currently doing this was you had to apply at each agency. It's really inefficient use of people's time. This bill creates a common portal to streamline the benefits application process. We hope this will create efficiencies for families who are applying not just for Mass Health, but might be eligible for other social services programs as well. Another victory that we are celebrating today is the extension of the Universal School Meals Policy. This was a federal program that was instituted during COVID to ensure that kids had access to free school meals regardless of their eligibility for them. The FY23 budget extends this program for 1 year in Massachusetts. While the legislation we were supporting would make this a permanent program, we're thrilled to see that this priority will at least be extended through 1 year. So we'll be looking again in the next session that starts in January to support this priority again so that kids can have access to healthy meals and have a successful day at school. Next slide, please. Another priority that was on our legislative agenda was the expansion of postpartum coverage for patients who have delivered a baby. This was done through a regulatory process, but this expands postpartum care coverage for folks on Mass Health from 60 days to 12 months. We know that healthy children can't thrive without a healthy parent. So we are hoping that this bill will really ensure that parents are able to access their postpartum care, and continue having continuity and care after the delivery of a baby. The last one on here, we have put as a victory, but it's not quite over the line yet. We had supported a bill that would increase the earned income tax credit at the state level from 30% to 40% of the federal tax credit. This is projected to provide financial relief to over 400,000 families in the state. However, work is continuing on this bill due to an end of session, I'll say snafu, in how much money is available to pay for this extremely large economic development bill that that this provision is included in. So you might hear from us through the can this fall if it looks like we need some help getting this bill over the line. But we know from our frontline community health workers that this, when families have more money in their pockets, that this goes back to basic necessities such as food and housing for their children. Next slide, please. So just to highlight the other bills that were on our agenda that didn't quite make it over the line, that we will be looking for support from everyone on this call in the next session. Cover All Kids. This bill would expand Mass Health coverage to kids regardless of their immigration status. We know that kids who can't access full Mass Health benefits often come to us with even more acute issues when there's delays in care or they can't access their medications. So this is going to be one of our top priorities next session as well. And we work really closely with our coalition partners on this bill. Emergency housing assistance for children and families experiencing homelessness. This bill would have created a presumptive eligibility for families who are coming to shelter seeking services. As we know, families sometimes end up here at the hospital when they feel that they have nowhere safe to go. And we're hopeful that this bill would kind of divert folks into an appropriate emergency shelter placement instead of coming to a healthcare setting. And the last bill that we were working on would have extended the current telehealth insurance coverage provisions for another 2 years. While this bill didn't get over the line, there was several commitments from the legislature through federal funding to expand internet access for folks who might not have reliable internet, which we believe will give people greater opportunities to access telehealth from home or wherever they're accessing telehealth from. So more to come on all of these issues. We look forward to engaging everyone through our advocacy network next year. And I should note on all of these bills, we can't do this without the partnership of our coalitions. We work very closely with other hospitals and other partners to get all of this work done. Next slide, please. So we also just wanted to flag that while a lot of the visible work that we do is through testifying at committee hearings and meeting with legislators and asking everyone on the call to, attend these briefings and also reach out to their legislators. Sometimes we are contacted by folks inside the hospital who are dealing with barriers at the state level that are resolved through either regulatory or agreements with the state that don't actually require legislation. So we thought we would just kind of flag a couple of victories that were in collaboration with our office and other folks throughout the hospital that came to us and told us about the issues that they were having so that we could reach out to the state and ask for some consideration in amending their policies. So on the first issue here that we have was when we were in the middle of the national infant shortage crisis. We had families who were having challenges accessing formula. There was a mass health requirement that, and all insurers have a requirement that there was a prior authorization for these specialty formulas. It was really creating a backlog of issues where families were getting to their pharmacy and the pharmacy was out of the formula that was on the prescription, and they had to write a new prescription, and it was very complicated for families to navigate. We worked with Mass Health and the Division of Insurance to suspend this prior authorization requirement through the end of the calendar year. And should, this issue continue to cause delays, we could reach it back out to the state and ask for an extension of that date. The second issue that's listed here was the state legislature had passed in January 2021 legislation that is related to the out-of-network surprise billing. That will prevent patients from getting, surprise large bills in the mail because they didn't understand that they were out of network. There was a lot of confusion around implementation of this bill, as there is also a concurrent federal No Surprises Act that is going into effect at the same time. Working with the state legislature, they passed a 3-year delay in implementation until January 1st, 2025. And then the last bullet on here, there is the Mass Health. We reached out to Mass Health as certain genetic testing codes weren't being covered. This was important for clinicians who really needed to test kids for certain genetic disorders in order to properly diagnose and treat the children, and we were able to work with Mass Health to get coverage of these additional testing codes effective January 1st of 2023. Next slide, please. As I mentioned, we can't do this without our Children's Advocacy Network. We just kind of pulled some numbers from all of the action alerts that we had. We had 8 action alerts with 28 separate legislative requests. 463 advocacy participants and 108 individual legislators were contacted out of the 200 that are at the legislature. We can't do this work without you, so we just wanted to take the time to thank everyone in this call for always being available to help, and we will be in touch about additional advocacy opportunities in the fall and as things emerge next session as well. So thank you for your time. I believe that is my last slide.
Awesome. Thank you so much, Shannon. I just want to make a plug for people to remember you can submit questions through the Q&A feature, and we should have a couple minutes at the end to take some questions. And now I'm pleased to welcome Amara Anasike, our Director of Behavioral Health Policy and Advocacy, to talk about some of the exciting victories we saw related to behavioral health policy at the state level this year.
Thank you, Elise. Hi, everyone. As she mentioned, my name is Amara Anasike, and I'm the Director of Behavioral Health Policy and Advocacy. Next slide, please. So at the beginning of the session, as Shannon mentioned, we did a survey, and what came back to us was the need to really address the psychiatric boarding crisis. And in case folks don't know what that is, it's when a child comes to our emergency department in need of acute behavioral health care, but because of capacity issues, there's not space in our inpatient psych unit, or a psych unit in this state. And so they have to wait either in the emergency department or on a medical surgical floor until a bed becomes available. So that was a major concern that we sought to address through our legislative process this year. We also wanted to make sure that we weren't thinking just on the acute side of things, that we want to address the full continuum of care. And so what came back was an opportunity to support schools in providing comprehensive school-based behavioral health care, right where kids are in the community. We also continue to advocate for behavioral health parity coverage. So making sure that behavioral health is being treated the same as physical health in terms of insurance coverage. And we also wanted to make sure that when kids and their families are going to urgent care, that there is some capacity to treat behavioral health needs in that setting. And so we really wanted to make sure that we had a comprehensive approach, given the crisis state that we've been in terms of access to behavioral health care for kids and their families. And so thankfully, thanks to everybody on this call and to our advocacy network, and also working alongside our coalitions like the Children's Mental Health Campaign, 100% of the bills that we worked on this legislative cycle received written and oral testimony from Boston Children's Hospital. And 100% of those bills were also signed by the governor or passed through other legislative mechanisms. And so we'll get into that in the next couple slides. And so happy to talk about Chapter 177 of the Acts of 2002, which was formerly known as an Act to Address Barriers to Care for Mental Health. This was an omnibus behavioral health care legislation, quite comprehensive, and it increases access to behavioral health care for children by advancing school-based behavioral health, reducing the burden of the behavioral health boarding crisis, and requiring insurance coverage for critical behavioral health services and more. And so I wanted to highlight, as I mentioned, quite a large bill, but I wanted to highlight the provisions that we worked on. In particular, the bills that we helped to draft with support from clinicians at our hospital and our coalition partners like the Children's Mental Health Campaign. And so in terms of addressing the boarding crisis, what the bill does is create a real-time data portal with information on how many children across our state are boarding and for what levels of care they're boarding for. And it would also pair that information with bed availability data. That way, folks like the resource specialists on our teams, the clinicians on the front line who are looking for appropriate placement for patients who are boarding, they'll be able to see that in real time and hopefully reduce administrative barriers and unnecessary delay. What that would also enable is for providers to be able to know and really assess the need, what is the scope of the problem, and how can we make the proper and adequate investments to build up capacity, and not just infrastructure capacity, but as a state, we've been thinking about how can we support our workforce, what kind of providers do we need? This kind of information is critical to be able to plan for that kind of capacity. And also in the bill, in terms of addressing the psychiatric boarding crisis, there's a provision that requires the Division of Insurance to implement regulations that would require payers to pay providers for the care that is being provided to patients as they are boarding, as they're waiting for care. And this is something that we found, and I'll talk about more in another slide, where providers are getting inconsistent or sometimes no reimbursement for the care being provided to boarders. And we know that if they're not being reimbursed, if we're not being reimbursed for services, it's very difficult to invest in the kind of care that is required. And so that was a huge win in terms of the legislation. Also, this bill developed an interagency review team for patients with complex behavioral health needs. And this is critically important because oftentimes a patient is boarding and it's not necessarily because there's not a bed, there's not capacity. Sometimes there's an issue with who was responsible to pay for an available placement. And sometimes with kids in particular, that payment might come from the Department of Children and Families. It might come from a local school agency. There might be a resource that the Department of Mental Health is supposed to provide. And when all those agencies can't come to an agreement on who's responsible to either pay for the care or manage the care for that patient, what happens is the patient loses and they're waiting in the inappropriate setting and aren't able to get that placement that they require. So with this review team will now be required to come up with a temporary cost sharing agreement way, when that agreement is in place, that patient can go where they need to go without waiting for them to figure out, ultimately who's responsible. And hopefully this will resolve that issue when a patient is waiting for weeks and weeks when there actually is a placement available. So this is critically important. There are a number of school-based behavioral health initiatives that are in this bill that are very exciting. And I will just talk to you about 3 of them. So this bill would develop a statewide school-based behavioral health technical assistance center. And what that means is any school or district who wants to have some technical assistance, information on the resources available to them, they will have access to this center. And this is important because what we found in our own research and in talking with schools, we found that some schools are really able to engage in school-based behavioral health and others aren't. And much of the time that's based on sort of access to community resources. It's not based on need. And so what this TA center will do, it will be able to provide access to schools and districts that might not have the resources that they need to be able to do this well. And we know that children, all of our children go to school. So it's important that we really leverage the communities that they're in so that we can hopefully avoid downstream sort of needs. This would also require schools to develop behavioral health crisis plans in their schools. And this is important because in schools already, there's a requirement for physical health crisis plans. And without a plan, oftentimes what happens is a child might have a behavioral health crisis in school. And because there's not a plan in place, the school might call the police, for instance. And we understand that might be necessary. And in small instances, we really want to avoid calling the police. If you can have like mobile crisis teams, for instance, folks in the community who are trained and available to address actual behavioral health needs. We want to do whatever we can to disrupt the school to prison pipeline and actually provide the services that kids need where they are. And then the school-based behavioral, the final initiative that I wanted to talk about was this bill would reduce the use of preschool suspension and expulsion. And actually, Massachusetts is one of the top 10 states in preschool suspension and expulsion. And so what this bill would do was put some guidelines in place in terms of when the use of that is appropriate and hopefully limit that. There are many parity and enforcement and coverage provisions in this bill. This bill would give the Division of Insurance more enforcement tools when there are parity violations. This bill requires coverage for annual mental health wellness exams. This bill requires appointments and examinations for children who are just recently entering the Department of Children and Families so that they're getting a behavioral health assessment. And so there are a lot of great parity provisions in the bill that will hopefully bring us closer to behavioral health parity. And then finally, there are a number of workforce studies in this bill, studies that will look into how can we diversify the behavioral health workforce. How can we think about a workforce pipeline? And on the next slide, actually, we can get to the next slide. This next piece of legislation will get into how we're going to pay for some of this and how some of this was paid for. And so when the federal government passed the American Rescue Plan Act in March, the Massachusetts legislature was tasked with allocating state funds to respond to the crisis. In November 2021, a legislator allocated $400 million to behavioral health, given the impacts of COVID-19 on behavioral health statewide. And Boston Children's, in collaboration with the Children's Mental Health Campaign and others, including the Mass Hospital Association and the Mass Association of Behavioral Health Systems, successfully advocated for the following investments. So there was $110 million that has been set aside for student loan repayment for behavioral health clinicians and across various disciplines, including social workers, psychiatrists, psychologists, nurses. So it's critically important. We know that there continues to be a behavioral health workforce shortage. There was also $7.5 million set aside for that portal that I talked about in the previous slide that would have information on patients who are boarding and would also hopefully expedite the bed finding process. There was $1 million set aside for the Technical Assistance Center that I talked to you guys about. And then there was also $1.5 million for pediatric urgent care grants, including language to fund and also language to fund innovations to reduce boarding. And so these bills kind of worked hand in hand to hopefully begin to address the children's behavioral health crisis that we are continuing to navigate. And as Shannon mentioned, there were various victories in the behavioral health space that were non-legislative. So I wanted to talk a little bit about that, and they definitely continue to go hand in hand with our legislative priorities. So I sort of mentioned this before, but historically, behavioral health boarders received inconsistent reimbursement based on arbitrary factors, such as where in the hospital the patient was first admitted. This is an issue on the pediatric side, but as well as on the adult side. And so government relations in coordination with internal departments such as payer relations, contracting, and patient financial services work together comprehensively. So not just advocating with legislators, but also with payers directly, both public payers like Mass Health and private payers. And so we first were able to track and monitor these patients' billing through new revenue codes. We work to educate payers about the inconsistencies and request reimbursement for all of these services. And as a result of this, Mass Health actually retroactively allocated funds to providers serving boarders, and Boston Children's received funding for FY22. And I just wanted to note that, again, without adequate payment for behavioral health services, access will continue to be a challenge. And so, again, we cannot thank you enough. Over the course of the last legislative session, we had 7 action alerts with 20 unique requests for behavioral health. 421 of you participated. 92 legislators were contacted over 507 times.
Awesome. Thank you so much, Amara. I'd like now to invite the other panelists to turn their videos on. And so we will get started with our Q&A portion. Thank you to those of you who have already submitted some questions. And we will get started. Thank you to all 3 of you for sharing some of just the exciting momentum and progress we made over the past legislative session. I was wondering if each of you could talk to a little bit about what you plan to see as our focus in the next legislative session, either areas or specific policies that we'll be focusing on. And then if you could also touch on how we develop our policy agendas in each of your 3 domains, and how someone who either works at BCH or is a community member could get involved in that process. And Shannon, we will start with you. And I think we have a slide to show. Great.
Thanks, Elise. So this is just showing a little bit about how we prioritize issues. Obviously I mentioned the legislative survey. We recently sent one out this summer. We are still analyzing the results. when we decide what is going to be on the priorities list, we really think about the mission, health and racial equity. What policies do we think are going to have the biggest impact on children's health, and all the other things that go on at the hospital? How can we leverage our expertise to show legislators what's going to have the biggest impact? Just because I just want to mention, if something's not on our priority agenda, we're always happy to help with additional advocacy for other things. It doesn't mean that's the only things that we work on. We do work on a lot of things that aren't listed on the main website as well. Next year, just based on the legislative survey that we received, we still heard a lot of concerns about housing and homelessness. So just taking a look at what policies will best advocate for that. We also heard a lot of folks that really want us to join in on the early education push. Access to early education benefits families in so many different ways. We'd really like to take a look at that as well. We also heard a lot of folks asking if we could take a look at policies that impact environmental justice and climate change for communities and families. So also taking a look at where we could insert our voices in that conversation. The best way people can join in is to obviously to sign up for the CAN, but if you have any specific groups that you work on or other information that would be helpful in the work that we do, please feel free to email me or email the CAN, and it will get to the right person, and we'd be happy to have you join in some of our more involved advocacy opportunities.
Awesome. Amara, do you want to speak to kind of plans for the next session and how we set our behavioral health agenda?
Yeah, I just wanted to say, especially based on some of the questions that are coming in, that it was great that this bill passed and became a law, but there's still definitely a lot more work to do in terms of making sure it's being implemented well. Again, I think somebody mentioned something about, okay, but boarding continues to rise, and a lot of the we need more capacity. A lot of the beds aren't staffed, and so some of that's it's going to take a lot more advocacy and us continuing to follow this. In the last legislative session, actually many beds came online, but many of them aren't staffed, and so we're really thinking about how we can support the pipeline in terms of a workforce. How can we support, not just loan forgiveness, but grant programs? How can we support training programs? So those are some of the things that we've been thinking about. Someone else mentioned sort of how are we going to implement the behavioral health crisis plans? And we're part of a school-based behavioral health advisory where we're thinking about how we're actually going to implement this in an effective way. And as Shannon mentioned, I'm always here to talk with folks. If they have ideas, feel free to reach out to me about how this is impacting you all on the front lines.
Awesome, thank you. Amy, do you want to just touch on how agenda setting looks a little bit different on the federal level and how we go about that?
Yeah, sure. I mentioned when I was speaking that a lot of our work is done in coalition with other children's hospitals from across the country, and also other pediatric research institutions. We're a smaller fish in a bigger pond when we're working with Congress. So we can be most effective, and we find that we share a lot of the challenges and concerns that other children's hospitals do. So we can be more effective working together with others. So we meet every couple of years. It'll happen again in December, in person again this year, with our peers, other government relations professionals from other children's hospitals. We meet in Washington, D.C. Every 2 years to talk about where we're going for the next 2. And we purposely plan it for after the election so we can have a sense of what Congress's priorities might be, and we can try to work within those constraints or to help address, make sure that kids have a voice in whatever that they're doing. So we like to hear from folks year round, but now is a great time at Boston Children's who are dealing with challenges that might have solutions that are in the policy, legislative or regulatory realm at the federal level. And we bring those ideas with us and those concerns with us when we meet with our peers. And a lot of times we find out that they share those concerns if they're federal. we have a lot more in common with other children's hospitals, with CHOP, for example, even though they're in Philadelphia, than we might with a hospital that's next door to us, simply because our patient population and the challenges that they face that way. So working together.
Great, thank you. And this could be for any of you. If someone was really excited after this session and really wants to get involved in advocating for kids' health with their own elected officials, what are some ways that they could do that this fall? And also, how can they stay in touch with our office and keep up to date with what we are doing?
Well, I'll start. I think, outside of some of the other advocacy opportunities that we mentioned that our office puts out, I think it's really important for everyone to get out and vote this fall. The general election is on November 8th. You can, if you're not sure where to vote or who's on your ballot, you can go to wheredoivotema.com. Researching who your local officials are and if they're supporting the issues that are important to you is one of the most important things that you can do this fall to make your voice heard. And just from my experience in working at the State House, legislators love to hear from their constituents. So, reaching out to your legislator and just asking what they're doing on kids' health can also just help you better understand what's going on in your own district.
Great. Well, we are almost at time, so I just want to thank everybody so much for joining us this morning. And thank you to our panelists for sharing some of the great work that's been done over this past session. I know a lot of links have been going through the chat, but please make sure to sign up for our Children's Advocacy Network that can, so that you can stay up to date with our office. And everyone who attended this today will be getting a copy of the recording and slides. And you will be able to stay in contact with us. So enjoy the rest of your day, and thank you all again. Have a good day.
Thanks.